advertise your business or your product. Call us on 0114 777 000 or email us on info@faithtodaytv.co.ke.
Every great journey begins with a single step. And at JCK Hospital College of Health Sciences, that step is met with warmth, guidance, and possibility. Here, learning goes beyond the books. It is where future healthcare heroes are nurtured by passionate instructors who believe in their potential. From theory to practical, our healthcare assistant students gain real-world skills in a real healthcare setting, preparing to serve, support, and make a difference from day one. Because at JCK Hospital College of Health Sciences, we don't just teach healthcare. We empower excellence. Admissions are now open for our May and June intakes. Step into your future today. Find us at Blessed House, 5th floor, opposite Garden City Mall. JCK Hospital College of Health Sciences, empowering excellent healthcare.
At JCK Hospital, we understand that a child's smile is priceless. That's why our dental services are tailored with care and compassion to ensure your little ones have the best experience possible. From gentle checkups to specialized treatments, our pediatric dental experts create a safe and friendly environment, making every visit fun and stress-free. Because we believe healthy habits start young. And for the grown-ups, we've got you covered too, with top-notch dental care for the whole family. Visit JCK Hospital today, located in Roysambu, opposite Park University on Lumumba Drive, and experience dental care that's gentle, professional, and family-friendly. JCK Hospital, you first.
In high-income countries, 8 out of 10 children with cancer survive. In low and middle-income countries, it is often less than 2 out of 10 children who survive. Now that is according to WHO's Childhood Cancer Initiative. Think about this. That fever that is on and off, that headache that comes and goes, maybe that swelling that you think is normal because it is painless. Could these daily symptoms be silent clues of cancer in our children? Now stay tuned as we unpack childhood cancers and what we need to do to achieve the survival of 80% like other countries that are doing well. Now greetings, welcome back to another transformative episode of the Healthy You program. My name is Enock Kitondekijja, your host, and I'm so honored to walk this journey of healing, health, and transformation with you. A special thanks goes to JCK Hospital. Now, these are our esteemed partners. They make this program possible. Again, they are the #1 advocates for health for the body, mind, and soul. Should you look for any health assistance, any consultation, even emergency services, you can reach them using that number on your screen. Of course, needless to say, they have JCK Hospital College of Health Sciences that is now currently onboarding their very last intake. Register with them if you want to become a healthcare giver. Again, using that number on your screen. Registration is ongoing and they are kicking off on the 13th of October next month. Good. Now, today's discussion is one that we onboarded last week. We started the battle against childhood cancers, this being the month of childhood cancer awareness. The argument is, how do we move from 20% to at least 80% survival in Africa? And to help us unpack this is no ordinary gentleman, an expert that is now becoming familiar to our faces, a pediatric surgeon working with JCK Hospital and helping countless numbers of people in our country. He has handled minor surgeries, complications, everything to do with childhood complications. He's the right person. But before I invite him to take us to the next level, I'm aware of those of you who are following us on social media. You do so well. Please remember to subscribe. And if this conversation makes sense, you can as well reach so many people with just that follow, that sharing, that liking. And in case you have any question concerning this discussion, use that number on your screen. The earlier you do, the better. Back to my guest, Dr. Mugo. Welcome back once again to Face Today Television.
Thank you. Glad to be back.
We are so honored to have you. Last week we had a discussion. It was more of a general overview of cancers in children. Today we want to zoom in now into the specifics. And some of the challenges we have in Africa today, there are actually 3 cancers that I want us to handle. To begin with, firstly is we have leukemias and lymphomas being a very huge challenge. But there are people who are following us from all over the world. They would want to understand what is this leukemia and how does it really impact lives to begin with.
So thank you, Enoch, for continuing this very important discussion. So as I highlighted from the first discussion, the most common childhood tumor is actually leukemia. So people ask, what is leukemia? So to explain it simply, leukemia is a cancer of the blood, specifically a cancer arising in the bone marrow. So what happens in leukemia is that the bone marrow starts making too many abnormal blood cells in very large quantities. And these abnormal blood cells now crowd out or squeeze out the normal blood cells. So this is what will bring about the symptoms of leukemia. If you're following our discussion from last week, you remember some of the danger signs you were saying was a child who has low energy is easily tired or appears pale, because they have very few red blood cells and not enough oxygen, so not enough energy, even to run and play. We'll have this child who has repeated infections, so they keep getting fevers, infections that are not going away. They treated, come back because they have very low numbers of white blood cells. And we talked about one of the danger signs was a child who bleeds or bruises easily. So, children are running around playing. They do tend to fall. That is common for children. But if you see a child after a small fall, they are bleeding. They have a very large bruise and it's not explained by just a small fall. So these are some of the key symptoms through which leukemia can present. They might also have bone pain because you remember the leukemia is growing in the bone marrow. So they'll be complaining of bone pain, especially at night, and it's not relieved by simple medication. So these are some of the things to watch out for when it comes to leukemia.
Bone pains.
Yes.
And how does it differ from malaria? Because we usually see, a child gets diagnosed with malaria, they treat it, and that's all. For us not to miss it, what should we really pay attention to? Yeah.
Yes. So we talked about the symptoms of cancer being chronic, okay? Symptoms lasting more than 2 weeks. So malaria is an acute disease. So the child gets sick quite fast. But if they undergo the correct treatment, they should recover completely. If you take your anti-malarial and anti-malarial dose is 3 days, a current treatment. So after that, the child should be completely fine and back to their normal healthy self. If after 3 days of treatment, there's still persistence of symptoms and the child doesn't look like he's getting better, then it is time to take a deeper look as to what is actually happening.
Well, for our viewers, those who are just joining us, we are getting into now the specifics of what really happens in our body and how you can tell that your child could be having cancer and you need to take action. You are treating this malaria, you get a bit of this change, but then it reappears. That is one clue you don't want to take lightly. And doctor is right here helping us understand what you really need to pay attention to. So for that matter, those of you who are tuning in, remember this is a program that is brought to you by JCK Hospital. Again, you can find them in Roysambu along Lumumba Drive, just next to Happy Life Children's Home. Dr. Ali, that's a good way to start our discussion today. And probably now we need to engage the next gear of understanding how do you get to now diagnose that this is now cancer.
Okay.
Yeah.
So talking about leukemia specifically.
Leukemia, yes.
We've said that this is a cancer arising from the bone marrow. So you need to get a sample from the bone marrow. And this is, so basically you need to get a sample from the bone marrow, obtain it from this child, and then take the sample to the laboratory for analysis. And over there, we have the assistance of very able pathologists. So under the microscope and using other special machines, they can actually tell that these cells are not normal bone marrow cells. These are leukemia cells. And that is how we make the diagnosis of leukemia.
Okay. So and how long does it take? What's the process like for you to come to a confirmation?
So for the
and how many tests? Are there any routine? Like you help us understand the actual tests.
Yes.
Yeah.
So you can have two main things. So number one, you can take a blood sample. And when you do the analysis of the blood sample, or just the regular blood, you might see there are very, very low numbers of your normal red blood cells, very low numbers of your platelets. Those are the ones that help in clotting. So when you get injured, you clot, you don't bleed out. And then you might actually see very, very, very extremely high number of white blood cells. So normally when you have a regular infection, white blood cells go up. But there is the level to which they are normally expected to go up. In leukemia, the levels will be 10, 20, 30 times that. So that can already give you a clue that something is amiss. And then now for the final confirmation, now you need to get a sample of not just the blood, but the bone marrow. So when you get a sample of the bone marrow now and look at it under the microscope, you can actually see now these leukemia cells because they do not look like ordinary bone marrow cells. And now the pathologist can actually come back with a confirmation that this is leukemia. So this is a process that will take at most 1 or 2 days. It's very quick, very rapid. And now once you have the final diagnosis, you can start treatment early. But it needs you as a parent to bring your child in for evaluation, and it needs the clinician also to order the right test so that we can get the right answer in good time.
I think you put out something very important. Having the clinicians do the work well, it's also very important here. Yes. Doing the right tests is something that we want to really emphasize on. And now taking us through the entire process of coming to a confirmation, a diagnosis.
Yes.
Is this cancer curable, and what are the treatment options like?
Okay.
Yeah.
So leukemia, it might be the commonest childhood cancer, but it is also one of the most treatable, indeed curable cancers. Okay. And leukemia is treated mainly using chemotherapy. Okay. So my role as a pediatric surgeon will be, because this chemotherapy, they are quite strong drugs and they'll be administered over many months. Okay. In order to remove all the cancerous cells and allow the normal bone marrow to take up its function again to make the normal components of blood. So my role as a pediatric surgeon, when you're called upon to see patients with leukemia, will be mainly to place a long-term line. So it's a long-term plastic tube. It's put under the skin and into a main blood vessel. And chemotherapy now is administered through this tube. They are called chemopods or implantable devices. Then the main treatment is now done by pediatric doctors who specialize in treating cancers. They are called pediatric oncologists. And they are the ones who administer the chemotherapy. And you monitor the response to treatment. Usually the response to treatment is very visible. So the child gets their energy back, they get their appetite back, When you take a blood sample, you will see that the blood now, the normal components of blood have started rising again. There are normal numbers of red blood cells, platelet, normal numbers of white blood cells. And when you take a sample of the bone marrow, you can be able to see that all the leukemia cells have been eliminated entirely. So leukemia is a very treatable and indeed curable cancer if it is found early and the right treatment is started on time.
Oh, that gives us a bit of hope when you say it's treatable and curable.
Curable.
We are wondering in Africa, why is the survival rate so low? I mean, numbers 20% and below.
Yes.
And what can be done?
Yes. So specifically for leukemia, again, this goes to the various factors we talked about. Number one, late presentation. So if a child presents very, very late with advanced disease, so their normal red blood cells are extremely low. They have very low oxygen carrying capacity, no energy. The body is in a very, very weakened state, okay? If they have very low numbers of platelets, they can easily bleed, okay? So they are basically presenting with a very, very advanced disease at which it is very difficult to reverse. Then secondly, we've talked about the treatment, which is chemotherapy. But the chemotherapy is administered over a long period of time. So you find, due to financial constraints, either the parents, the child cannot access this chemotherapy because these are a bit expensive drugs, or they cannot even be able to finish the entire treatment regimen. So they come for 1 or 2 sessions, then they disappear. So, and then now basically lack of awareness, among the public, among clinicians, to screen for these cancers, and to refer these patients early to a specialist who can treat. So these children often are treated for malaria, they have been treated for, pneumonia, they've been treated for this, they've been treated for that. Before the diagnosis of leukemia is finally made, a lot of time has been lost. And now these are some of the factors that lead to a very low survival in our environment compared to the Western countries. However, it's important to note, even here in Africa, for children who follow the treatment regimen to completion, our cure rates match those in the Western world.
Yes. Wow. And I mean, this is very, very timely. It's a discussion that during this month of childhood cancer awareness, to know that childhood cancers are not, it's not a death sentence. When your child has been diagnosed with leukemia, the expert here is telling us, as long as it is caught earlier, it can be handled. Daktari, we want to engage the next gear, having known that, leukemia, you guys can deal with it as long as our people can come in early. Let us now handle lymphomas. What are they, the causes, and how do they differ from other childhood cancers?
Okay.
Yes.
So very good. So lymphoma, this is also another very common cancer, very important to discuss. So lymphoma is a cancer that arises from the immune system, the cells that are normally housed in organs called lymph nodes. Now, lymph nodes will be like, I will say, the barracks of the immune system, okay? So this is where immune cells are housed at nearby body locations. So if you have, let's say, an infection in your throat, it is common for the lymph nodes at the back of your throat to swell, and that is visible, okay? But now, how does lymphoma differ from a normal throat infection? Very key message, the duration of symptoms. So when you have a regular throat infection like a tonsillitis, yes, the lymph nodes around your neck will swell. But once you take your antibiotics and once the infection subsides, then the swelling of the lymph nodes should go down, okay? But in lymphoma now, since now this is a cancer that is growing, the swelling persists. So you have persistently swollen lymph nodes in whichever part of the body is affected. They might be in the neck, it might be in the groin, it might be in the abdomen, okay? These swellings are slow, they grow, they may or may not be painless, okay? But they will keep on, the swelling will persist, and in fact, the swelling will keep growing. So this is one of the key things that should alert you that now we are not dealing with your regular illness. This might be something that needs to be checked out.
All right. And do you mind just spotting the areas where we can see these swellings?
Yes.
Yes.
So it will be the areas where the lymph nodes are found. So lymph nodes are found all over the body. So they can arise from the neck region. So you might have a child coming in with a neck, jaw swelling, okay? It's been there for many months and it's slow growing, okay? Sometimes they might be in the groin. Sometimes they might even be in the abdomen. Then these may or may not be accompanied by other symptoms. For instance, weight loss. So this child is eating very well, but just not gaining weight and even losing weight. This child will have fevers, so unexplained fevers. So when you take the temperature, this child is febrile, but you cannot explain what is the source of this fever. And they may or may not also have night sweat. So they wake up at night and the clothes and the sheets are soaked in sweat. So these are some of the red flag symptoms that should warn you that we are not dealing with an ordinary swelling here. And this should be checked out.
All right, and because the lymphatic system is all over the body, so you can expect it will help us serve you better. Dr. Ali, I know you missed one. I think even our viewers, I'm sure, they're sending in questions about the causes. Yeah. If you take us through now some of the causes of these lymphomas, and then I know we are going to now talk about the treatment plan. Yeah.
Okay.
Yeah.
Yes. So when it comes to childhood cancers in general, a lot of them are due to a mutation. So genetic mutation.
Yeah.
When the cells of the body are multiplying, which they are supposed to do because this child is growing, right? So something goes wrong in one of the cells, and then now the cells start multiplying uncontrollably. And as I said, they specifically focusing on childhood tumors. These are tumors that are occurring in some of the most quickly growing places in the body of a child. So for instance, for leukemia, the bone marrow is actively making more blood because this child is growing, this child is active, okay? Lymphomas are occurring in the immune system because, again, as this child is growing, they are getting exposed to new bacteria, new viruses, and the immune system is constantly on the lookout and trying to fight them. Other childhood cancers will be in other growing organs of the body, kidney, could be the bones, could be the soft tissues, the muscles. So that is the key number one thing that I want you to take away, or our viewers should take away, is that a lot of these things are just arising from a mistake in the genetics and in the genetic makeup of the cells as they divide and multiply as the child is growing. Okay. So I want to contrast this with now adult cancers. Since a lot of our viewers are actually interested in cancer as a whole. And for adult cancers, one very important thing is environmental exposure. Okay. And what are these environmental exposures we are talking about? We are talking about things like cigarette smoking, things like alcohol intake, things like your diet. So diet, salt, high in saturated fats, ultra-processed foods. And then exposure to certain things like some chronic viruses like hepatitis, human papilloma virus that causes cervical cancer. Okay. Herpes viruses, HIV in itself has also been linked to development of cancers. But in adults, all these environmental exposures need time. Okay. So that's a very important message. Need time. These cancers take time to develop. Okay. So while for childhood cancers, when you talk about prevention, we're really talking a lot about early recognition and early screening for these children. In adults, we can talk about reducing your exposure to these noxious agents. And as well, because these cancers take a long time to arise, for adults, they're actually screening programs. Okay, so screening programs for healthy adults in order to catch these things early. So like for women, you talk about breast cancer screening, cervical cancer screening by doing regular pap smears. For men, we talk about prostate cancer screening. We talk about colorectal cancer screening because now they can be caught early before they become big and start growing. In children, the key message should be that because you're talking about cancer that is arising in somebody who is 1, 2, 3 years old. So environment does not really have a big role to play. This is something that is genetic. But when it is caught early, indeed, it is completely treatable and completely curable. Because again, as I'm saying, this child is growing. So once you wipe out the abnormal cells using the various treatment modality, then this child continues growing and has a normal life.
Wow, it is getting better because the discussion of now environment, most of the discussions I've had with medics here, is the challenge is people don't pay attention to some of the behaviors. For example, you talk about smoking. people think it is only the active smokers mostly who are affected. But now these young children are affected, I believe, more profoundly because, I mean, being vulnerable, I mean, the bodies are growing. You get these, you could call them small exposures, but given the body and you know the rate at which these children take in, you realize it is actually more than what adults take in because they are small and they're taking in a lot compared to the adults. Many people take it for granted. So when you talk about, you allude to environmental exposures, I think that is something our viewers should not take lightly because these children we are looking at, yes, much as these other adult cancers take longer, you know, for them, it may not appear instantly, but it can affect them later in life. So for our viewers, Daktari here is helping us understand, as much as we see these cancers so much, the adult cancers are manifesting after some years. For the children, you don't want to take lightly. If you are smoking, just know that you are affecting the children around you, and it could impact or translate into a cancer at some point in life. So even our behaviors, the way we live our lives, they are watching, they are taking in, and they are really following our example. Daktari, I see so many questions coming in here, but before we answer them, is this lymphoma treatable? Is it curable?
Yes.
Clear that.
Very, very important question. Lymphomas are entirely curable. Okay. Then how do we come in as clinicians? So we will get this child who is referred to us with this swelling on the side of their face or on their neck that is just not subsiding. Very common that they have been treated with antibiotics, you know, for tonsillitis or for whatever, but this swelling is just not resolving. And already now somebody has had the suspicion that we are not dealing with an ordinary cancer. So my role as a surgeon is to get a sample of that lymph node when it is whole, okay? And very important, especially for any clinicians that are watching, for lymphomas, you don't want to get a small sample using a needle. There is something called a fine needle, a biopsy for any clinician that is watching. But if you're suspecting lymphoma, do not do a fine needle aspiration. You need to get the sample of the whole lymph node. So this is something that should be sent to a surgeon. The surgeon will extract one of the lymph nodes, one of the swollen lymph nodes, because you need the pathologist now who will look at it under the microscope needs the whole lymph node, not just a few cells, so they can be able to spot any cancerous cells. So for me as a surgeon, I will take a sample of the lymph node, that is called a biopsy, and then I send it to the pathologist. Again, you can see how different health specialties are coming into play. Then now the pathologist looks at it under the microscope and confirms to us the diagnosis of lymphoma. And now once that is done, then now this child can start the proper chemotherapy for lymphoma. And by using the appropriate treatment, the lymphomas, actually the resolution is among one of the most rapid among all cancers. It's extremely treatable and extremely curable, but it must be found in good time and the right treatment started.
The right treatment started. I like more of that, and I know we're going to take a short break. When we get back, I want us to also now get into the Wilms tumor, the way you have explained thoroughly the lymphomas and leukemias. For the Wilms tumor, it's a bit challenging for so many people. We also want to understand, is it curable, or for it has a different approach? Now, for our viewers, that is enough reason that you should not miss the second part of our discussion. We're going to take a short break, and when we return, we're going to talk about Wilms tumor and the difference between Wilms tumor and kidney cancers. Today, we are really giving you quality stuff. So if you would, I would recommend you share this discussion with as many people as you can. And if you forgot to subscribe, I think this is also a good time for you to press that subscription button so that you can get everything, every quality content we have to deliver at Faith Today Television. When we return, we're also going to give you a bit of how do we move from 20% to 80% survival in Africa. Do not change that dial.
Every great journey begins with a single step. And at JCK Hospital College of Health Sciences, that step is met with warmth, guidance, and possibility. Here, learning goes beyond the books. It is where future healthcare heroes are nurtured by passionate instructors who believe in their potential. From theory to practical, our healthcare assistant students gain real-world skills in a real healthcare setting, preparing to serve, support, and make a difference from day one. Because at JCK Hospital College of Health Sciences, we don't just teach healthcare. We empower excellence. Admissions are now open for our May and June intakes. Step into your future today. Find us at Blessed House, 5th floor, opposite Garden City Mall. JCK Hospital College of Health Sciences, empowering excellent healthcare.
Faith Today TV is here to make your brand outstanding. Worry not on where to advertise your business or your product. Call us on 0114 777 000 or email us on info@faithtodaytv.co.ke.
Hello there, my name is Enock. Taking care of your health should be a top priority. Looking at the various engagements that we have today, it is so easy to forget about our health, mental well-being. That is why we introduce to you the Healthy You Talk Show, a brand new show that is going to address matters concerning your health, nutrition, stress management, mental health, name it. We bring to you a wide range of experts who are going to be touching pertinent issues concerning our health. Tune in every Tuesday at 10 a.m. live on Faith Today TV.
Hello there, welcome back once again to our second segment. The battle is against childhood cancers. This very month of September is a month dedicated for childhood cancer awareness. And we are really serious about it. We do not want anyone to really fall a prey, because in the first part of our discussion, we learned that the first two cancers are actually treatable and curable with the right approach. We gave the details. And in our second part, we want to talk about the challenging Wilms tumor. We want to know what it means and what are the causes. Then we get to also understand, is it even curable like the rest of the other childhood cancers? We are here with an expert from JCK Hospital, a consultant that is helping countless number of people's lives in Africa, changing their stories, changing their sentences. There is hope. Daktari, welcome back once again.
Thank you.
We want to engage the next gear because you have given us quality info as regards to lymphomas and leukemias. Now, let's handle this elephant, the Wilms tumor. What is it?
Wilms tumor. So Wilms tumor is a cancer of the kidney. Okay. It's just been named after Wilms. So Wilms is the person who first described it. But when you talk about Wilms tumor, you're talking about a cancer of the kidney. Now, which age group does Wilms tumor affect? Wilms tumor is a cancer that affects toddlers. So usually patients are between 2 to 5 years of age. Okay. And now as their kidney is developing, some of the cells in the kidney now start multiplying extremely rapidly. Okay. And now this leads to how does Wilms tumor present? Okay. For Wilms tumor, because now it will be a mass in the kidney that is just growing and growing, so you might feel a mass, so feel something in the abdomen of your child. So, sometimes you want to see your child with a big belly and you say that this one has eaten well. But maybe when you're bathing them or changing them and you hold their tummy, you can feel, there's something new that I've not felt before. There is actually a mass in this child's abdomen. You, as a parent, you may feel that, or even when you take your child for their regular checkup, their growth checks to the regular pediatrician, as they are checking, because the pediatrician is supposed to check their ears, nose, throat, mouth, check the chest, check the abdomen, and as they feel the abdomen, they can feel there is a mass there. Usually this mass is painless, okay? So it's a painless mass in the abdomen. Sometimes in rare cases, because this is a kidney tumor, you might see urine, you might see blood in the urine, okay? But this is not very common. The commonest presentation of Wilms tumor is actually just a mass in the abdomen that is painless and slow growing but present.
Okay. And so, Wilms tumor, take us through now the treatment plan. Is it even one of those cancers you guys have the capacity to deal with, or it is something that you're still making research about?
So when it comes to Wilms tumor treatment, this is actually one of the most survivable cancers worldwide. Especially when you check the Western literature, the survival rates are excellent. And the treatment of Wilms tumor is in 3 main ways. So we've been mentioning some of these treatment modalities as we're talking about other cancers, but we can use Wilms tumor to illustrate how cancers in children are treated. So the first thing for Wilms tumor, you give chemotherapy, okay? Now, what is chemotherapy? We're talking about chemotherapy. So chemotherapy, these are quite strong medications that target any abnormal cells, especially those that are multiplying very rapidly, okay? So chemotherapy targets cancer cells because cancer cells are known to be multiplying much more rapidly than the normal body cells, okay? So for Wilms tumor, when you give chemotherapy, this cancer shrinks. So the mass shrinks. So if it was a very large mass, it will become a smaller mass, okay? Then now, as surgeons, this is where we come in. The next thing is now to take out the cancer completely from the body. And this is where surgeons, we come in. Our role is to operate and safely remove the affected kidney with the cancer, while making sure that we do not spread these cancer cells anywhere else in the abdomen. So as surgeons, we do a surgery. It's called a radical nephrectomy. So removal of the affected kidney, which has the cancer, and you're supposed to remove it whole, intact, without leaving any cancer cells behind. But depending on the stage of cancer, how much this cancer has spread, you may not be able to be successful with the surgery to remove the entire cancer. You might find that the cancer, by the time you're going in for surgery, yes, the chemotherapy has shrunk the tumor, but you might find that maybe it's sticking to other important organs that you do not want to touch as a surgeon. So you remove what you can safely and then come out. Then now this leads to the third treatment modality of Wilms tumor, which is radiotherapy, okay? So what is radiotherapy? So radiotherapy is basically using a high energy rays. So high energy rays that are focused on the affected part. So these now will, in essence, burn away, if I may use that as an example, okay? So use these high energy rays that are focused on the affected part, and whatever cancer cells that were left behind after the surgery, now they are burnt away with the radiotherapy. So Wilms tumor is actually a very good example to show how all these different treatment modalities are combined in order to completely eliminate the cancer. And once you do this, like in Western countries, the survival rate is over 95% for Wilms tumor.
Survival rate,
yes,
for Wilms tumor,
yes,
is beyond 95%.
yes.
I think that's good news. For our viewers, you can only get such quality stuff and hope from Faith Today Television. Again, this program is brought to you by JCK Hospital. Recently, they've had a training for first aid. It was free of charge. I mean, they charged no coin. And we saw so many people come up to attend this training, but it was all in creating awareness about the college that is right now having its last intake, September intake, October intake actually. So on the 13th of next month, we are registering students. If you want to pursue this course for nursing care assistants, use that number on your screen. They are waiting to deal with you, to give you a priority if you are from this program. As long as you tell them, I'm from watching this show and I'm excited, I'm sure they will give you a good a discount. Yes, that is JCK Hospital College of Health Sciences. Again, those of you are tuning in, we learned that cancers are dealt with right here in Africa. I mean, we get so much hope that even as to 95% results. And also, if you can be able to know what you're supposed to do a bit earlier, there's so much hope. All right, let me begin with the first a question. I am getting this from Kim. Kim, thank you so much, Kim, for watching Faith Today Television. Kim says, good morning. Is childhood cancer treatable, or does it always come back later in life?
Okay. So, Kim, thank you. That's a very good question. So, childhood cancers are extremely treatable, extremely. And usually once it's eliminated, the same cancer will not recur later on in life because you've eliminated any abnormal cell. So this child is only left with normal cells and they grow up to have a normal, healthy life.
All right. Kim, it can be dealt with once and for all. Then treatment is very expensive. What options do parents who don't have money really have?
Yes, so this is one of the very big challenges that face treatment of cancers in Kenya. It's the finances. So in that one, there is really no escaping. The treatment is prolonged. The treatment is expensive. You have to do all these things, chemotherapy, surgery, radiotherapy, and all these things cost money. And this is why we always advise you need to have an insurance cover. Take the insurance cover early. Make sure that you're covered. You take the insurance cover for a rainy day. You don't take it when it's already raining. So have it so that if you need the treatment, then you'll find that our insurance covers both for the public one using the Social Health Authority or even the private covers. They're actually able to cover the cost of this treatment very well. So that will be the key message. So be prepared for a rainy day, so that you're not caught off guard, because the financial implications, as I said, are quite extensive. However, all hope is not lost for the treatment centers that offer cancer care in Kenya. So a lot of them usually have welfare or support systems. So do not feel discouraged out there and just, say that there is no help is always available. Just bring the child. We all want to see this child survive and succeed because they are the future. So even if you've had the diagnosis and maybe you're not prepared, a lot of these places, the main treatment referral facilities, there is always room to have this compassionate care or welfare support. There are a lot of support groups that, give financial support for children who have cancer. So don't feel discouraged. Still bring the child. But if you are sitting at home hearing this message, make sure you get insurance so that you're prepared.
Insurance.
Yes.
Is very key.
Key.
Good. We have Stella. Stella says, hello, I'm Stella. So is cancer in children the same as in adults, or is it a totally different disease?
That's Stella, thank you for that. That is actually a very, very good observation. So they are both called cancer in the sense that these cells are multiplying very rapidly, much more than expected to. So in that way, yes, they are both cancers. However, childhood cancers are quite different if you look at the science and the genetics and, you dig deep into it. They are very, very different from the adult cancers. So in childhood cancers, you'd find it's really one or two cells. In the course of their normal multiplying, they become abnormal, and now they start multiplying very rapidly. Mm-hmm. And this means with targeted treatment, you can actually eliminate those one or two cells that are misbehaving, and the cancer disappears entirely. And this is how childhood cancers have a much better cure rate compared to adult cancers. For adult cancers, you will find that because a lot of them arise because of time. Okay, so the time factor is very important, and environmental exposure. So for adults, they will have large numbers of abnormal cells. And then from those large numbers of abnormal cells, 1 or 2 actually now take the next step and become cancer. So it is actually very difficult to treat, or not very difficult. It is more difficult to treat adult cancers compared to childhood cancers,
Okay.
because you have a big pool of abnormal cells from which now a cancer has arisen.
Okay. Thank you so much. We have Yusuf from Tome. Thank you so much, Yusuf, for tuning in to Faith Day Television. Yusuf says, how do you explain to a child that they have cancer without scaring them? I think you should tie that into also the parents as well.
Yes.
The approach.
So thank you, Yusuf. This is a very sensitive discussion, of course. But I will say we do have, as clinicians and the other supporting professionals that we rely on when we are treating children with cancer. First of all, you must approach the issue with truthfully. So do not lie to the child, so truthfully, but sensitively, and explain it in an age-appropriate way in which the child can understand. Okay. So, for instance, if you're talking to a 2 or 3 year old, you might say that, there's this part of your body that maybe is growing too fast. It's affecting the other organs, and that is why you need to take medicine. And the medicine now will target the part of the body that is growing very fast. Sometimes you might be taken by the doctor to the operating room, put to sleep. And now when you wake up, you will find that the part that has been growing too fast has been removed, is missing. So you really need to explain to the child truthfully. So do not hide the diagnosis for them. For them, when you tell them cancer, they really do not know what that means. Okay. It's not the same as for an adult, where, by the time you get to adulthood, the word cancer is equated to a death sentence. Children really do not understand what this is, but they can understand that, they are sick. They can understand that they need to take some medicine for some time in order to eventually feel better, to get back to being healthy, to get back to playing with their friends, to get back to school. And you can also explain to them that everybody who they encounter in hospital is actually trying to help them to get back to the journey to help. For the parents, I would say as well, again, it's important to be truthful. So say this is the diagnosis, and also be truthful and open that the treatment will be prolonged. So this is not an acute illness. The treatment will not be for 1 or 2 days or 1 or 2 weeks. This treatment will be for months. It's important to finish all the prescribed courses of treatment and all the different modes of treatment. They each have their role. So follow the treatment regimen as has been prescribed, and also give them hope that a lot of children, if treated correctly, actually survive these childhood cancers and go on to thrive.
Good. Thank you so much, Daktari. We have another one saying, if one child in the family has cancer, are the siblings also at risk?
Generally, no. Generally, no. Because most of the, we say genetic mutation, so these cells transforming, it is sporadic, okay? It's like being struck by lightning. There are very, 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 very rare cases of familial cancers, extremely rare, and most of those we have not touched on them because they are not very common. And for those, you usually will find they've had genetic screening. Even the parents, actually, it is not just the cancer arising in the child. Even the parents are they know that they have a higher cancer risk. And through genetic screening, their children are screened early, and then they can be told that because of, your parents' genes, you have a slightly higher risk of developing, let's say, breast cancer or endometrial cancer or colonic cancer. As examples, those that are screened for genetically. But for the childhood cancers that you're talking about, generally, no, it will just affect the one child.
Okay.
Yes.
All right. Of course, when you look at what the entire world is actually concerned about these childhood cancers being treatable, but there are also people who lose lives. There are children who lose lives in the process. WHO has a plan. Their initiative is to at least increase survival to at least 60% by 2030. What does that mean for Kenya and Africa? How do we get to also probably come to 60 or even beyond 80%?
Yes. So as you correctly said, currently our survival statistics are quite poor compared to the rest of the world. And we have quite a lot of work to do in order to get better survival rates, okay? We know what needs to be done. Actually, we just need to do it. Number one is increase awareness. So this is how programs like these and initiatives like this, Childhood Cancer Awareness Month, are very important. We're increasing awareness in the general public that cancer is not just a disease of adults or the elderly, that children can also get cancer. These are what to look out for. And if you spot your child having these and these symptoms, please take them for a checkup by a clinician so that if it is cancer, it can be spotted and dealt with early. Then we need to do a big investment. So this involves financing, okay? So investment in healthcare financing, health insurance schemes have to cover the treatment cost, which I've said is quite expensive, okay? We have to build more referral centers. So right now we have just them in the big city, but you see not everybody lives in the big cities, okay? So we need to have these centers distributed, okay? You may not need to do all the cancer treatment, out there in the periphery, but at least somewhere where a proper diagnosis can be made, So somewhere that have the proper imaging facilities, laboratory facilities, they need to be more widely available so that the diagnosis can be made quickly, and then now this child maybe can be sent to a tertiary referral center. We need to invest in the personnel because, health is a service industry. So you need investment in personnel. We need a lot more doctors, first of all, doctors and clinicians and nurses just to do the general screening. And then we need a lot more specialized doctors who will go into the various treatment aspects of cancer. So we need to have more surgeons, more radiotherapists, more oncologists. So all these important personnel, we need to really do a heavy investment to have these people on the ground so that even when the child is diagnosed with cancer, then they have the people to treat. Then we need to invest really in the medication. So things like drugs, do we have a good system to make sure that these drugs don't go out of stock, because sometimes this happens, the child can be on their treatment course and then when they come back, they're told, oh, these medications are out of stock because a lot of them are imported. Can we start making more of these drugs locally? And if we make them locally, we make them available at a cheaper price to the patient. So this is something that is achievable, but it needs willpower, it needs the focus, and it needs all these things to be put in place so that finally, when the whole system is in place, you'll find that our survival rates will even be better than the 60%. We can even aim for equivalent survival rates like the Western countries.
Okay. Well, I think that's a call to action to bigger bodies, and I'm sure the message is home. I know we are about to conclude this discussion, but before we do, I think it's very important about the idea of, because you've stressed early diagnosis being very fundamental in dealing with these childhood cancers, but there's now the challenge of misdiagnosis and then underdiagnosing. What are some of those challenges you people are finding, and what would you recommend to be done so that we can have perfect diagnosis at all health center levels?
Yes. So this, as you've correctly said, this is quite a big problem. But I think, especially now as we're having programs like this, we raise awareness. Number one, red flag symptoms, okay? That should not be ignored. Of all the red flag symptoms, the key thing you should take away is the duration of symptoms, okay? Children are not supposed to have chronic illnesses. Yet adults, you can have your diabetes, your hypertension, you're living with heart failure, kidney failure. Children are supposed to have acute illness. They get, a flu, cough for a few days, but they get better. If there are some symptoms that are persisting and not being explained very well, seek further clarification. And even for the clinicians, if you're treating this child sore throats all the time, or you're treating malnutrition, you put them on a good diet plan, they're not gaining weight, there is this swelling on the side of the neck that is just not disappearing, you need to rethink this, whether I have the right diagnosis, really, okay? So the chronicity of symptoms, do not ignore chronic symptoms in a child. And then there are particular red flag symptoms for the common childhood cancers that we have mentioned. We have mentioned the low energy, loss of playfulness, easy bleeding, repeated infections, these swellings that are appearing on the body and are slow growing, bone pain, early morning headaches and early morning vomiting associated with maybe convulsions. These are things that you should not ignore. So even for clinicians that are watching, do not ignore these chronic symptoms. If you cannot explain where the symptoms are coming from, refer this child early to where they can be properly evaluated and the right diagnosis made.
Wow. I think today we are becoming so solid with the ideas for our viewers. I'm sure you are taking a lot in today from our consultant, but because of time, Daktari, I believe we have really handled the key areas of childhood cancers. We have created enough awareness. So what would be your parting shots as we wrap up childhood cancers for this month?
Okay. So my parting shot is this, that childhood cancers is indeed a thing. So this is a disease that occurs in children. So you want to create awareness, okay, that this is an entity that occurs, and we prevent these children from being underdiagnosed or misdiagnosed. We want to catch these children early. But my real parting message is a message of hope, that this is not a death sentence. Even when you get these children with cancer, these cancers are entirely treatable and indeed curable. So we're not talking about managing, we're talking about 100% cure if caught early. And these children go on to live normal, healthy, and productive lives. And we can do it. We can do it in this country. So this is a message of hope. Even if your child has been found to have cancer, it's not the end. We are here to help. We have the professionals, we have the tools, we have the capabilities, and these are diseases that are curable.
These are diseases that are curable. Well, thank you so much. Dr. Mugo, every time we have you on the show, we only get, quality content. Your expertise is another level. We really appreciate, and thank you so much again, JCK Hospital, for making this program possible. You can find Dr. Mugo at JCK Hospital always. And did you share your contact?
Yes.
Okay.
So you can follow me online.
Yep.
My links are Rob Mugo, Dr. Robert Mugo. Search for me online, Facebook, Instagram, on TikTok. And then you can always reach me. My professional line is 0738 491 953. That is 0738 491 953. And you can reach me if you have any questions or any discussions. I'm here to help.
Yes, he is right here to help. And of course, physically, you can meet him at JCK Hospital, just right here in Roysambu along Lumumba Drive. We get to learn 3 important things about childhood cancers. That awareness is very important. Getting to know the red flags is something that can help us deal with it earlier and more effectively. We also get to learn that early diagnosis is very key. Early detection is a key point here. And then we also learn that treatment is possible. There are various forms of treatment that the medics, the experts have to help you deal with this cancer. And we've learned that you can as well move from 20% to even beyond 80%, like how other countries are performing right here in Africa, if we just follow like our expert has guided. Again, we acknowledge so many of you who follow us from hospital. You are in maybe at home, you are following, and you are under any form of treatment. We want to give you hope. Yeah, we want to let you know that the doctors, whatever they are doing, they're only an extension of God's healing hand. And we pray that may your healing come forth speedily in Jesus' name. My name is Enock Kitondekijja, and you have been watching the Healthy You program. Until we meet next time, stay proactive, stay informed, and stay healthy. God bless you.
Thank you.
At JCK Hospital, we understand that a child's smile is priceless. That's why our dental services are tailored with care and compassion to ensure your little ones have the best experience possible. From gentle checkups to specialized treatments, our pediatric dental experts create a safe and friendly environment, making every visit fun and stress-free. Because we believe healthy habits start young. And for the grown-ups, we've got you covered too, with top-notch dental care for the whole family. Visit JCK Hospital today, located in Roysambu, opposite Park University on Lumumba Drive, and experience dental care that's gentle, professional, and family-friendly. JCK Hospital, you first.